Hi, my name is Dr. Robin Abramczyk, and I'm a holistic biological dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I am here today with Dr. Mary Ellen Chalmers. She is a functional biological dentist in Santa Rosa, California. And Dr. Chalmers, I would like to ask you, where do you feel that we have failed our patients in the field of dentistry?
I think the primary issue right now is that we need to be able to address our patients' individual needs. We need to be able to communicate with them and make the connections between some of the health issues that they're having and the problems that exist in their teeth.
Absolutely. Where do you see the future of dentistry going?
Well, from my perspective, I have a heavy education in functional medicine. I've also been educated with Dr. Philip Malika and Bob Harris at their Integrative Biologic Dental Medicine program, and it's the integration of the two. I think what I feel, the beauty that functional medicine has to bring to our profession is that, number one, it's going to give us an ability to communicate with our medical partners, be they osteopaths, MDs, chiropractors, acupuncturists. It's going to give us a language, and it's going to give us a foundation for communication that's really going to enhance our ability to take better care of our patients, number one. And number two, there's been such a disassociation, a fractioning within the profession. You have the anti-amalgam camp and the pro-amalgam camp. You have the, root canals are horrible and there's nothing wrong with them. What I believe functional medicine will allow us to do is, as we understand it as dentists, and as we use those principles, we can begin to identify patients that shouldn't have a root canal. We know from the studies that diabetics, for instance, they don't heal. I mean, that we can better tailor our diagnosis and our treatment plan for the patient based on what their individual systemic needs are. Their genetics will come into function, their diet will come into function, their lifestyle will come into function. But as we begin to encompass that, as we diagnose and treat and plan our patients, I think it'll be huge for dentistry, because we know that so much of illness begins in the mouth, and we really need to migrate from becoming molar mechanics, where we focus on fixing that tooth, to physicians of the mouth, where we focus on treating the whole system.
One last question.
Yes.
Based on the literature, what patients would it be ill-advised to have a root canal?
As we see it right now, as I mentioned when I spoke yesterday, I'm married to a Harvard-trained retired endodontist who refers to himself as the preacher that doesn't believe in God anymore. That said, we recognize that the articles that I quoted about the importance of the brain and cognition, that study published in 2010 from the Netherlands that talked about the fact that patients who were edentulous without their teeth had a much higher incidence of dementia. There's an article that's just been published this week in the Journal of Dental Research, a highly regarded journal in this country, that talks about the importance of occlusion for neuroplasticity. That's the ability of our brain to adapt and to make appropriate neuronal changes. So our teeth are a critically functioning, they're a critical organ in our body. Also, the core of functional medicine is food, right? Food is medicine. And if we don't have teeth that occlude properly and that can masticate properly, we're not going to be able to partake of the number one thing that's going to heal us. The patients that we try to counsel away from root canals are, number one, diabetics. There was a study published about a certain cytokine called interleukin-1 beta. That's an easily obtainable test through some of the different laboratories. So patients who have genetic polymorphisms for interleukin-1 beta, meaning that their bone, if they look like they have a compromise in their bone, that's probably someone we're not going to think will need a root canal, because the bone around the area will heal. My husband always maintained that areas with large cystic lesions, it's going to be very difficult to restore that blood flow and to get that bone to heal. So areas where we're really people who are sick, Lyme patients, cancer patients, chronic fatigue patients, if patients need their immune systems to be doing something else, maybe a root canal is not for them, and they should consider an implant. one of the most profound statements John would say to patients towards the end of his practicing career was he would do that root canal because he felt they had an immune system that could manage what he was about to do.
Interesting, interesting. Thank you so much for
You're
sharing.
welcome. It was a delight to meet you.
Thank you so much. And thank you for joining us today.